So really what we're seeing here with the cold weather program in the county, most of the residents of this encampment have been put in hotels as the cold weather consistently stays below what,
15 degrees.
So, but if tomorrow the hotel program ends, a bulk of these people are coming right back to this. And this is important for y'all to see and document, because this is a reality for a lot of people in our community, and it's not a good one. This is the Wild West out here. There's no filters. There's drug and alcohol use back here daily. Pretty widespread. We're not here to judge that. We're bringing them harm reduction, making sure they have Narcan, you know, the test strips if they need to test their dope. But this can definitely be, you know, pretty gnarly back here, and that's just there's no way around it. I'm Rob Mutter, the executive director and founder of Warp Core.
So why did you start Warp Core?
We had lost a young man to suicide that was serving in the Army. He took his own life, and that was about as heavy as anything I had dealt with in a long time. So we had a memorial service, and that day, it was kind of a reconnection with me with a lot of young people that I knew when they were kids. You know, it was kind of, hey, how's Jim? How's Tommy? How's Susie? And you don't know? I'm like, no, I don't. And like, what? Heroin. Gone, gone, gone. It wasn't, you know, oh yeah, they're in bad places. It was dead, prison, you know, jail. And that just blew me away. That was like, you know, getting kicked in the stomach by a mule.
Here in the state of Illinois last year, we lost about 4,000 people. That is 10 Illinois citizens a day. 2019, there were 92,000 deaths. And by 2021, it was up to 107.
My name is Laura Crane. I'm with the McHenry County Substance Abuse Coalition. The trends that we're seeing are definitely fentanyl. So in 2017, what was the peak was heroin and prescription medication. What's driving all the deaths right now is fentanyl. Without a doubt, fentanyl is in 75 to 85% of overdose deaths, whether it's in our county or any other county you look at.
We work with people impacted by substance use disorder, individuals, their loved ones, and the community at large. So fentanyl is 50 to 100 times more potent than any other opioid out there. It's also very cheap. So you can purchase this on the black market from China. So we're not only seeing overdoses in people that have a substance use disorder, we're seeing recreational users die as well. One of our local high schools recently lost a 14-year-old freshman who got a pill that he thought was Percocet off of Snapchat, and he died, a freshman in high school. Today, I had lunch with my friend Kim, who lost her daughter Abby a month ago, and Abby leaves behind a 2-year-old child. We haven't gotten toxicology back yet. It takes 3 to 6 months in Cook County to get that, but we do believe it was fentanyl because that's all that's out there. And she was struggling and had a reoccurrence after being in remission for a while. And her boyfriend found her dead in bed with her daughter in the room. So that's what I mean. These are people's kids. These are people's mothers. These are not bad people trying to do good. These are sick people trying to get well.
We are not straight edge. We're not don't do this, don't do that. We say test before you ingest. It's just that simple. And there's a lot of people here, myself and many others at Warp Core. If you have questions on that stuff, you come see us.
How's it going? I'm Clay Mutter.
I'm Rob Mutter. Welcome to Warp Core. We are real people. Come on inside, check out our place.
Warpcore is a social enterprise that uses music, art, and action sports to combat homelessness, suicide, and overdose death in the community and beyond. Their mission is to prevent these problems by engaging young people in personal, informal interactions and providing healthy, productive outlets. Their motto, Prevention Through Engagement, reflects their belief that this is the most effective way to address mental health and substance use issues. To fund their programming and operations, Warpcore sells gourmet coffee and custom apparel. They have a full retail space in their headquarters on the Woodstock Square. Almost all of their programming is free of charge, making it accessible to everyone. Warpcore provides youth music and art workshops, interactive events, homeless outreach and support, crisis intervention, connectivity to support services, a safe space for youth, meeting spaces for partner organization and support groups, and distribution of Narcan and fentanyl test strips in their community.
A couple years ago, I tried to gather a statistic on how many treatment cycles did a long-term person in recovery have to go through to get sober, stay sober, no more relapses, and start the path of a productive, positive life again without this horrific addiction. And at that moment in time, the number I was told is 7. So 7 30-day treatment programs was the average at that moment in time for somebody to obtain long-term success. And for me, that's a broken system.
So I'm Clay Muter. I'm the head of business operations here at Warpcore. Our main revenue stream is through our custom apparel production, the print shop right downstairs. We got our retail here. You know, skateboards are always a fun seller for the skaters. Coffee is a big revenue generator for us as well. And we drink a little bit too much of it ourselves here, but our customers and the community really seems to enjoy it too.
You know, if you're gonna do a social enterprise, it's because of that exact word, social enterprise. You know, we can do these things, revenue generate to make enough money to do what we gotta do, and maybe a little more. God forbid, you make a few bucks. That's not a bad thing. We all need money. I am a capitalist. Everyone can't just say, I just wanna be rich and fuck everybody else. You know, we got to get back to a space and time where we care about each other and we love each other, and we're gonna hand up, not a handout. That's one of my mottos.
Tell me about your business model, because you started as an L3C. So can you first tell me where you even hear about the concept of L3C? Because it's a very Illinois. Illinois
it was
thing.
created right here by an attorney in Chicago.
Yeah, an L3C is the only for-profit entity design in the United States that places mission above other objectives permanently and irrevocably by law.
So Mark, what is a social enterprise?
Yeah, look at the two words. It's an enterprise, therefore it's a business that generates earned revenue, and it's social. It seeks to drive positive social change by addressing a social or environmental problem.
Can you say directly or indirectly what your impact has been on suicides and drug overdoses?
Before COVID, we had 8,400 door swings, about 4,500 direct engagements on harm reduction, i.e. issuing fentanyl test strips and Narcan back out into the community. We clearly have had over 100 reversals of overdoses with Narcan that we put out into the community. Easy. Probably more, but when somebody uses Narcan on their friend, they're not necessarily gonna come back here and say, Rob, I used that shit on Jim last night. The very first Narcan save we had was probably 3 days the damn doors open here. And we had done one Narcan training to the community. You know, there was active users coming here, the boyfriend, girlfriend team, and the boy came running in here screaming, I need Narcan. And at that moment in time, we had 1 dose in the building. And it was in one of my employees' backpacks. Oh, here, because it went out. What we had went out. And she was overdosing right here on the Woodstock Square, around the corner. And he came running in. We gave him the Narcan. He ran down there, squirted in her nose, and literally 5 minutes later, they were both back in this building.
Regardless of what happens, if we're just able to help one person, you know, that's worth it. I believe that what we're doing here, you know, can provide new template for how we can address these issues in a positive way, in a practical way, and in a way that's sustainable, financially, where you can, continue to provide services to folks that doesn't break their bank, where you're still able to, to not live in poverty yourself,
Where I can really make the biggest impact on this fucking nightmare of the mental health crisis and the heroin epidemic and opioid epidemic was prevention through engagement. Get the kids again before they're corrupted. And that was pretty simple for me to just say, I need another skate park, but I need more, because not every kid is a skateboarder. People need basically three things: something to do, a place to do it, and somebody who gives a shit about them. If a kid wants to learn how to weld, I'm gonna find somebody to teach that kid how to weld. If they wanna be a carpenter, I'm gonna find somewhere to teach them how to be a carpenter. And we can do that very small here, but in phase two, we could, if we got a big enough building, 15, 20,000 square feet, we could do all of these things under one roof.
I've watched Rob engage with these kids, and it is really remarkable. They need strong role models that don't have any judgment about who they are or where they're at. They need a safe place.
If WarpCore could design a place where there was physical activity of all sorts, right? A skate park, a training center, it allows kids and even adults a chance to come and gather to do activities that aren't available here right now.
As you look at the opportunities presented by social enterprises in general and L3Cs in particular, this is a bipartisan, multi-sectoral initiative. If you look from the perspective of progressives or liberals, they see the L3C and social enterprise as an enhancement to the social safety nets. The Republicans or conservatives see it as government doing more with less, and they see it as empowering the traditional business and investment communities. Everybody benefits from employing a market-based strategy, which is what social enterprise is.
So I think the dark side is that fentanyl's not going anywhere. Fentanyl's not the worst thing out there. There's more that's coming. We know that the synthetic drug system is set up so that they can just change the compound, and there's worse out there. We know right now there's a drug out there called xylazine. Xylazine is actually an animal tranquilizer. That's not reversible by naloxone, and we're seeing that substance out there mixed with fentanyl and other substances. And so we can reverse something that's got a narcotic base, but we can't reverse tranquilizers. We can't reverse benzodiazepines, which are now creeping back into the drug system. And so that is not going to change. We're going to see those numbers continue to be a problem.
The key to this, where we have to have outlets for young people, because without those outlets, that's why people fall into those darker places.
We gotta welcome everyone, and I don't give a shit. Everyone is welcome here, as long as they don't come in, maybe as an opponent. Short of that, everyone here is welcome, because we're trying to build a community, bringing people together.